U.S. Health and Human Services Secretary Robert F. Kennedy plans to dismiss the department's expert panel on preventative care. That's according to reporting from the Wall Street Journal. That expert task force was established in 1984 to provide recommendations about preventative care. So these are things like cancer screenings. An HHS spokesperson telling CNN no final decision has been made. It's important to note, though, that the journal's reporting comes after RFK Jr. had called off this month's task force meeting. Joining me now, internal medicine physician Dr. Lipi Roy. So it's good to have you with us, Dr. Roy. So when you hear this, the fact that this panel may go away, practically speaking, what would that mean?
Good to be with you, Erica. So as a former primary care physician who relied heavily on the recommendations by this U.S. Preventive Services Task Force, as you mentioned, it's a 16-member group of experts, national volunteer experts trained in internal medicine, preventive medicine, pediatrics, obstetrics, gynecology, family medicine. These are individuals who go through rigorous systematic review of the scientific literature in order to create these clinical recommendations for healthcare professionals like me. And as I said, as a former primary care doctor and now as an addiction medicine doctor, I've always relied heavily on these recommendations so I could provide the best possible clinical advice to my patients as to when they should get a mammogram to screen for breast cancer, when they should get a low-dose CAT scan or CT scan to evaluate or screen for lung cancer. The reason why these recommendations matter is because, first of all, science evolves. It's constantly changing. So we need experts to evaluate that literature so that folks like us can understand it and then explain it to our patients and to the public. The earlier you're able to screen for something, the better that you are able to treat it and manage it, and ideally to prevent it, Erica.
There's also a question of, so we know if certain vaccines are not recommended, that insurance may not cover them. So this also could come into play when we're talking about preventative care. So if all of a sudden you have HHS, saying we don't necessarily recommend that you get a pap smear every X number of years. We don't recommend early breast cancer screenings. In a country where healthcare is increasingly costly, and for many people it can be tough to find healthcare in their area that is actually under their insurance plan, could this lead to insurance also not covering some of these preventive measures that have perhaps been covered for decades?
That's an absolute concern among my patients, the public, and certainly amongst medical professionals like me. Insurance companies, they have their own metrics in terms of why they fund or cover certain services. A lot of that's based on science. It's based on advisory panels like this Preventive Task Force. So what's concerning for me and a lot of my colleagues is that this decision by RFK and HHS to dismiss this Preventive Task Force is part of this disturbing trend. As you and your team have pointed out last month, RFK dismissed the advisory panel ACIP for vaccines in the at the CDC. I mean, look, these vaccines have been tried and true as the most effective preventive health strategy or tool to prevent diseases. I mean, there's a reason why you and I, Erica, do not wake up in the morning coughing or bleeding out because of an infection caused by tetanus or polio. We're not waking up paralyzed with our brain and spinal cord because we have vaccines, medicines based on decades of research that we got when we were babies that prevent us from getting these diseases. This is a disturbing trend, Erica, and it's disturbing because I wonder what's the rationale for making this decision. So, is it politically influenced? It's very disturbing.
So so that, real quickly, because we're a little tight on time, but that gets to one question that I have for you, which is, do you see anything about, in terms of what you know about these committees? As you noted, the science is constantly evolving. We're constantly learning more from research. So the members of these panels are typically going through a lot of that because they're experts in their subject matter. But is there anything that you've seen over the years that says to you, we should eliminate this wholesale? That we would be better off in the United States to not have the recommendations from a group like this Preventive Care Task Force?
I see no evidence why there would be any kind of rationale, any science-based, evidence-based rationale to eliminate this group. If it's for cost cutting, I'm all for cost cutting, but cutting back on costs and services has to be based on data. What actual data do they have? If they want to actually fund research, what they should be funding research and services for are for substance use disorders, mental health disorders, women's health, loneliness, depression. All of these are social media, gambling, gaming addiction. There's a lot of growing health concerns that I believe HHS should be funding and looking into. But eliminating this task force, that is not the way to go, Erica. I believe it's going to harm a lot more people. Things are going to get worse before it gets better, in my opinion, Erica.
Dr. Libby, we really appreciate your expertise. Thank you for joining us this afternoon.
Anytime.